Some quick daily stats. Our easy visits have been accessed now by 934 people, with 385 using the COVID-19 code to waive fees. Our midnight census was 358, which is up from yesterday, so I don't know if that's the new kind of moderating level as normal business goes on, as well as preparing for COVID-19. And just to remind people, we are licensed for 640 beds, 538 currently available, and again, our midnight census was 358. Test results, we have now tested 44 individuals. 32 of them have come back negative. The other 12 are pending, with 10 of them currently inpatients at Bryan Medical Center. One thing that we want to get out to folks, we are still hiring people at Bryan. We currently, our team of over 5,000 people is looking to add additional positions. We currently have 168 clinical openings, everything from phlebotomists to patient care techs to registered nurses. And we have currently 72 non-clinical positions, anything from nutrition and dining services, biomed, medical technicians, registrars, people to work in our daycare and the child development assistant positions. So if people are interested, please go to bryanhealth.com, and in the upper right-hand corner, click Careers. It'll give you all the information you need if you are seeking employment right now and are interested in some of our openings. Before I turn it over to John, I'm going to share a little bit about the call for support from the community. The response has been tremendous, frankly overwhelming. The priorities at this time are in rank order, probably N95 masks and gloves. If you are interested in finding out how you can help support us and our frontline caregivers and the entire team here, here's the number to call, 402-481-3032. You'll be greeted by people that will direct you to the most current list of needs and how you can help. I want to spend some time, though, sharing with you what the community has done. We do believe this will be somewhat of an ongoing effort until the national and international supply chains become more reliable. Again, N95s and PAPRs are probably our top priority. I'm not going to be able to mention everyone here because this briefing would become pretty dang long, but I want to recognize some folks, and then we'll also recognize everybody on our social media channels. But the sampling, it's just been totally awesome so far, and our entire team, particularly our frontline clinical staff, offer our most sincere thanks. So by Friday, we will have 2,500 face shields produced. They are being produced by Southeast Community College and Nebraska Innovation Studio on the Innovation Campus. Southeast Community College has assembled a task force. They're sweeping their departments to locate additional personal protection equipment for us. I don't have the final count numbers, but this morning we received a shipment from Nebraska Wesleyan University who accessed personal protection equipment from their lab and throughout their facility. N95 masks are very critical in a healthcare setting. We have had in the past day 3,516 of them donated collectively from Willard Electric, Sampson Construction, Lancaster County Medical Society, Kindred Psychology, Lincoln Parks and Recreation, the Federal Building Maintenance Shop, Jeannie Bright, and again, they have donated over 3,500 N95 masks. We also received 10 R95 masks, another real heavy-duty industrial mask from a member of the community. Surgical mask, we received 1,000 from Sue's Nails. And then for the non-surgical grade masks that our volunteer seamstress are producing, an additional 1,500 in the past day. As previously reported, 9 PAPR units from Hausman Construction. We received 1,700 shoe covers from individuals and from ConAgra in Lincoln. We received a ventilator from Companion Care Veterinarian Clinic. And we have received 5,834 sets of gloves from individuals. 2,500 of those came from Iron Brush Tattoos. So to the good folks at Iron Brush Tattoos, when we get through this, I don't currently have one, but I'm coming in to get a tattoo. Be thinking of the right design for a middle-aged, older white guy. Thank you very, very much for all that you're doing. Again, the number to call to inquire about additional opportunities.
Thanks, Bob. I'm John Woodrich, CEO of Bryan Medical Center. I did want to re-emphasize again, our drive-through is opening up at 2 p.m. today and will operate until 6. Individuals coming there will do that through a physician order. And the way that'll happen is when your physician either screens you via phone or if you use the Bryan Easy Visit, a call will be made to our scheduling center. Our scheduling center will then call you to set up the exact time for you to arrive. Typically what will happen is you'll probably have an influenza test at that time. We'll get a result within 15 to 20 minutes. If that is negative, we will do a respiratory pathogen panel on you, send you home, ask you to self-isolate. You will be receiving a call from us in about 24 hours from that time period. Based on what the results are of that and your conditions when you arrive, you may be a person selected to have a COVID test. That would have already been collected when we did the respiratory pathogen panel, so you will not need to come back. You will just be notified if it will be that a sample will be sent for a COVID test. COVID tests could be anywhere from 2 to 4 days till we get those results back. We're using an outside lab for that right now. I did want to mention and send out appreciation to the Lincoln Police Department that has been awesome with helping us set this up, and they will be out there to handle any traffic flow issues should those occur. And plus our health department has been very supportive of us setting up this drive-through clinic. I did want to mention at the same time, of course this is a major thing that's going on in our community right now, but we still are continuing to take care of people like we typically care for in a normal day. We're still delivering babies here. We deliver about 300 a month here at Bryan. We're still doing heart surgeries. We're still doing acute surgeries and taking care of our community for any needs that arise. And I want to thank our employees, the ones that have been really engaged in getting the communication out as well as making the appropriate preparations for the COVID-19, but also those employees that continue to take care of the folks that utilize our services day to day. With that, I'd like to open it up to any of the questions via chat. So if we do have a person that is identified as a positive COVID case, we do have a separate area for what we're going to say is our COVID patients. But currently now when a patient comes into our facility and we work with the health department to do the testing, we provide that isolated environment, we provide the protective equipment for our staff, and we are able to take care of those people in negative pressure rooms. But we have designed units where the entire unit will be negative air pressure, so should we see a surge of COVID patients, we have areas designated for that, and we have plans for both campuses as well as multiple units if that surge would occur. So when people enter the area of the parking lot, there will be a tent there where people will check in. Someone will have a laptop to verify that you do have a doctor's order to attend the drive-through. Then you will be guided to another area where you will pull your vehicle completely underneath this tent, because we don't know what the weather conditions will be in the near future. That's where they would do an influenza test, a swab test, have you wait about 15 to 20 minutes, and then we would make a determination at that time based on the results. If it's negative, you would move on to the respiratory pathogen panel. If it is positive and we can identify you have influenza A or B, you will be given instructions. It could be Tamiflu or whatever. You would pick that up and then go home. If you then have that respiratory panel, after they do that, they will just tell you to go home and self-isolate, and within 24 hours, you would be receiving a call. Part of this is that we don't want people to leave their vehicle, want to just see contamination occur. Our RNs will be down there. We have some other staff that will just help with maneuvering people through the parking lot. We want to make this as simple to access as we can for people, but I do just want to reemphasize this has to be done through a doctor's order. So we don't want people to just show up to try to go through that drive-through area. We do have the capability of people that have not gone to see a doctor could come to the urgent care center side and go through what we call the respiratory infection side. And we've been seeing roughly between 15 to 20 people a day that go through that side. Easy Visit is probably the simplest way for a person that is feeling these symptoms to get that approval or see a physician. And once again, if they use the COVID-19 promo code, there is no charge to the individual doing the Easy Visit. So right now, the fee for the COVID test, whatever the outside lab is charging us, we pass that on to the patient. There is no markup to the charge. So if we're able to get the lab to do that test for $100, that will be the charge that the patient sees on their bill for the COVID test. We believe that we will have enough to do for a number of weeks at 60 vehicles a day. We will look at the volume as time goes on. I think all of you are aware the environment's changing by the day. If we have to extend the time, we will look at doing that. We'll try to have a segment maybe in the morning and the afternoon. We might do something at night. It all depends day by day how much this service is being utilized. We always have financial assistance that we do for individuals, and if people go to a doctor and the doctor sends them to the drive-through, we will get the test administered to you. We will handle all of the financial aspect of that after the fact. You know, depending on the expansion, we're going to work with our Lincoln Police Department. We want to make sure that we don't stress that neighborhood. We will be looking at alternative plans should the volume increase that we needed to determine an additional site. So those plans are happening behind the scenes, but we really need to get a few days under our belt here just to see what type of response we're having to the drive-through.